So there are several questions within your question. The first question asks, is there an upper age limit for treatment? And to answer that question, you have to think about what kind of treatment are we talking about. Are we talking about blood transfusions? Are we talking about different kinds of tablets? Are we talking about different injection treatments? Are we talking about chemotherapy? Are we talking about stem cell transplantation? It depends what that treatment is. And second question that you're asking is there an upper age limit within the NHS? So there are two different points. So the first point of view is there is no, as you know, there is no age limit for having care. Care is very variable in the NHS, and it's variable for all sorts of complicated reasons. How good are the doctors and nurses, and how good is the administrative team, and the clinics are run, and all that sort of stuff. How good are just the organisation of the hospital, all that sort of thing. So there's a lot of variation. But I would say there is absolutely no limit to care. And the second thing I'd say is that there is no age limit with respect to any of the tablet treatments that are available and licensed and funded. There are limits to treatments that would harm people. And you have to then think about the risks and benefits, such as transplantation or such as chemotherapy that can cause damage as well as good. And in those cases, you have to have a very thoughtful conversation. None of that is limited by the NHS.
Could I just ask, on that line, so continuing that train of thought, judging by the comments of a number of people who use the MDS UK community online, in the elderly age group, in which I now class myself, they seem to be advised by local clinicians that it's not worth being referred to a centre of excellence, which does worry me, because they only deal with transplants or clinical trials. So would you consider that being above a certain age would preclude you from being a viable candidate for a clinical trial, in that might potentially cause harm to that particular patient?
Yeah. So this is a complicated question, but it's a really good question. So I have a very, very simple rule, and I kind of use it, and I even used it this weekend in an email that I sent to my colleagues, my consultant colleagues, and copied Caroline Orme in it. And that is, when thinking about these issues, there is only one principle. What is best for the patient? There's only one principle. And nobody should assume that they know what is best for the patient without talking to the patient. And you can only talk to the patient properly if they've been properly informed. So by definition, every patient in the NHS should have access to excellence, by definition. Because not every doctor or nurse is a specialist. So every doctor in the NHS and every nurse in the NHS should be humble enough to say, I know quite a lot about this, but I may not know everything. And if I don't know everything, there may be somebody who does know more than I do. Nobody knows everything. And if you'd like to go and see person X, who knows more than I do, please feel free to tell me. Now, not everybody will want to do that, because it might be 80 miles down the road and it's not easy to get there and all the rest of it. But that should be offered. Now, this is a very personal view of mine. I'm not speaking on behalf of my hospital or my colleagues or the NHS or anybody else. But I think if you're logical and you think about it, it begins and ends with the patient, begins and ends with asking them what they want, and they can only know what they want if they have as much of the facts as possible. Does that answer the question?
Well, yes, you're singing from the same hymn sheet as me, but that's what should happen. I'd love to know what the answer is to making sure it does happen.
Well, I think it's a cultural issue. I don't think it's anything other than that. So I think, if you're being treated in place X and the vista, if you will, of those people in place X is this, that is the vista. They can only have a different vista if they're exposed to it, to a different landscape, right? So cultural change takes time.
Professor Myers, you talked about the different donors, the sibling, the unrelated match, and the haplo. How do you weigh them against each other, especially if the siblings are past their sell-by date?